But how do you decide which bariatric surgery is the right one for me, this person has said? So
I'll start the consultation over. Yeah. So
well, yeah.
So the first thing, we try and give patients the choice. So patients will often come to us saying, I would like X procedure. And I'd say most of the time, we'll go through the history, we'll look at them, we'll find out a bit about them, and we'll say, yeah, agree completely. Or I might say, there's no benefit to the other procedures, so you go with what you feel is right. There are some conditions where there are clear benefits about which surgery you should have. So a few brief ones would be, smokers shouldn't have a bypass. They're more likely to get complications after that. I mean, ideally, you should be stopping smoking before surgery for a minimum amount of time. But if you are, patients are honest, they'll say, I think at some point I might go back to smoking. I've smoked for X number of years. So I wouldn't do a bypass. I wouldn't do a bypass in someone who's given up smoking in the last, I would be against doing a bypass in someone who's given up smoking, certainly in the last year or two. I'd be very wary about it. They can have it, but I would say you've got to be a minimum of 6 months to a year off smoking, and you'd be better off with a sleeve gastrectomy because of the risks around the surgery with smoking. And ideally, you've stopped smoking, you think you might go back again, we should probably avoid the bypass because you can get later complications. Again, there's other medical problems. If you're a diabetic, some of the evidence for some diabetes show these surgeries can cure diabetes. If you're type 2 diabetic, you can certainly, make it better. And the data shows, half of the patients who are on things like insulin, we can get them off it. We can get them off all medications within 2 years. So again, that might be better with the bypass over the sleeve. So this is something where, like you have, Fulvio, someone say, I want an abdominoplasty. Well, what do you mean by that? Let's work out and understand, well, what are you hoping to do? What do you do outside? What do you do for a living? What do you want to do going forward? Do you want to have kids? Where are you in life? What are your other medications? So I could talk. That's what the consultation's about. Really.
That's the whole.
That's the whole gist of why we would need to sit down and talk about things.
Yeah.